37 million Americans have chronic kidney disease right now, at this very moment. And here is the part that should stop you in your tracks. 90% of them have absolutely no idea. Not because the signs aren't there. The signs are there. But because every single one of those signs looks exactly like something else. Tiredness, aging, dry skin, a metallic taste in the mouth that comes and goes. Things you would never, ever connect to your kidneys. And once you understand what your kidneys actually do for you every single day, you'll see why this matters so urgently. Your kidneys filter 50 gallons of blood every single day, without rest. They regulate your blood pressure. They produce the hormone that tells your bone marrow to make red blood cells. They activate the vitamin D your bones depend on. They do an extraordinary amount of work, quietly, in the background, without ever asking for your attention. Until one day, they cannot anymore. And here is the cruel part of how kidney disease works. By the time most people actually feel, obviously, undeniably unwell, they have already lost more than half of their kidney function. And that loss is permanent. There is no going back. Which is precisely why catching the early signs, the subtle ones, the ones that look like something else, matters so much. So today I'm going to show you 7 subtle, often missed signs that your kidneys may be quietly shutting down after 60. Signs that are, statistically, happening right now in millions of people who are completely convinced that they are fine. And by the end of this video, I'm going to give you the names of 2 specific blood and urine tests that you can write down and ask your doctor for, by name. 2 tests that could change everything for you. Let me tell you what's coming. So you'll know it's worth staying with me. 7 signs. Sign number 1 is something you may have already noticed this morning and not thought twice about it. Sign number 3 actually shows up on your face, and most people blame it on allergies or aging when, in reality, it's pointing at something far more serious. Sign number 5 is the most counterintuitive on this entire list. It has nothing to do with urination and nothing to do with fatigue. It shows up in your mouth of all places, in the way your food tastes. And sign number 7 involves a number that your doctor already checks at every single appointment, a number you probably look at yourself. But almost nobody connects it to their kidneys until the damage has become serious. So please, stay with me to the end for that one. It will genuinely change how you read your blood pressure results forever. Let's begin. Sign number 1 involves something that you actually observe every single day, multiple times a day, without ever giving it a second thought. Healthy kidneys are remarkably efficient at concentrating your urine. That's why your morning urine, when you've been asleep for hours, is typically darker. But kidneys that are beginning to fail lose that concentrating ability quite early in the disease process. They start producing more dilute urine in larger volumes, and that means your bladder fills more often. So here's the question. Are you finding yourself getting up 2 or more times every single night just to go to the bathroom? And is that a change from your previous pattern? Something that's developed over the past year or 2? If so, your kidneys genuinely deserve investigation. This nighttime urination change is often the very first sign of kidney trouble, appearing years before any obvious illness sets in. But there's something else I want you to look at as well. Look at your urine itself. Specifically, does it foam? I want you to picture this carefully. Urine that froths like beer when it hits the toilet bowl, with foam that does not quickly disappear, that lingers on the surface of the water. That can be a clear indicator that protein is leaking from your kidneys into your urine. And that matters enormously. Healthy kidneys are designed to keep protein inside the bloodstream, where it belongs and where it's needed. Damaged kidney filters allow that protein to escape into the urine instead. That protein in the urine has a name. It's called proteinuria, and it is one of the very earliest detectable signs of kidney damage. It can show up years before you feel any other symptom at all. So here is exactly what to do. The next time you see your doctor, ask them by name for a urine albumin test. That is the specific test that detects this protein leakage. Write it down right now on a piece of paper or in your phone. Urine albumin test. That simple test could give you a definitive answer in 24 hours. Sign number 2 is the one most people have been blaming on age, on stress, on poor sleep for years, maybe even decades, and it's almost never the right explanation. Here's the mechanism, because once you understand it, the sign makes complete sense. Your kidneys produce a hormone called erythropoietin. That hormone has one critical job. it signals your bone marrow to produce red blood cells. So when kidney function declines, erythropoietin production drops along with it. And fewer red blood cells means less oxygen being delivered to your brain, to your muscles, to every organ in your body. And the result of all this is a very particular kind of fatigue, one that feels completely different from ordinary garden variety tiredness. This kind of fatigue is bone deep. It settles into your body and stays there. It doesn't fully clear after even a good night's sleep. And on top of that, it comes with a mental cloudiness, a kind of fog. You may find yourself struggling to concentrate, forgetting words right in the middle of a sentence, losing track of conversations you're actively participating in. And most people, understandably, attribute every bit of that to simply getting older. What makes this so insidious is that this kidney-related anemia develops so gradually, so quietly, that you actually adjust to it without even noticing. You start needing afternoon naps where you didn't before. You quietly stop doing things that used to energize you. You tell yourself, well, I'm just getting older, this is how it goes. But I want you to hear this clearly. You are not just getting older. Your kidneys may be failing to produce the very signal your blood needs in order to carry oxygen. So here's what to do about it. If you're experiencing this kind of unexplained persistent fatigue, especially if it's combined with any of the other signs we'll cover, ask your doctor to add a full blood count to your next blood panel. That simple test will show whether anemia is present. Sign number 3 is one I want you to actually check tomorrow morning. First thing, before you've been upright and moving around for more than a few minutes, look at your eyes in the mirror. And here's what to look for specifically. A smooth, water-filled puffiness around your eyes, particularly under and around them. Now, I want to be careful here, because this is different from the loose, saggy under-eye bags that develop naturally with age. This is different. This is a smooth, fluid-filled fullness that wasn't there last year. And let me explain the mechanism, because it's actually a beautiful, if alarming, illustration of how interconnected your body is. When your kidneys are damaged and protein is leaking into the urine, the way we just discussed that protein loss from the blood reduces its ability to hold fluid inside the blood vessels where it belongs. So fluid quietly seeps out into the surrounding tissues instead. And the delicate, loose, pliable skin around your eyes shows that fluid accumulation first, before anywhere else. Because that's the most easily affected tissue on your entire face. The puffiness is typically most pronounced first thing in the morning, when you've been lying flat all night and fluid has had time to pool. As you stand up, walk around, and let gravity redistribute the fluid through the day, the puffiness may actually reduce a bit. But the underlying problem hasn't gone anywhere. So here is what to do. If you notice that this eye puffiness is new, something that wasn't always part of how you looked, and it isn't easily explained by allergies, or eating salty food the night before, or crying, then please bring it up directly with your doctor. Specifically ask them about kidney function. This is one of the most overlooked and most specific visual signs of early kidney damage that exists. Now, signs 1 through 3 are the ones most people would never even suspect were connected to their kidneys. But signs 4 and 5 are even more surprising than that, because neither of them feels like a kidney problem at all. One of them is a relentless, maddening itch that nothing seems to fix, and the other is something that happens every single time you sit down to eat a meal. Most people who experience these signs have been treating both of them as completely unrelated conditions for months or even years, with no idea they're connected to the same underlying cause. Sign number 4. Picture this. You've tried switching your laundry detergent just in case. You've used every moisturizer and lotion your pharmacy carries. You've taken antihistamines from the allergy aisle. Nothing works. The itch just keeps coming back on your back, your arms, your legs, without any visible rash, without any obvious trigger, without any clear pattern. Just an itch that won't quit. This phenomenon actually has a name. Doctors call it uremic pruritus, or in plain English, kidney itch. Here's what's happening. When your kidney function declines, all those waste products that healthy kidneys would normally filter out of your blood begin accumulating instead. Substances like urea, phosphorus, and various uremic toxins deposit themselves into the skin, irritate your nerve endings directly, and produce a persistent itch that is completely, frustratingly unresponsive to all of the standard treatments for skin-related itching. That's why the creams and the antihistamines don't work. They're treating the wrong cause. Now, I want to be fair here. Itching is incredibly common and has many possible causes. Dry skin alone causes a tremendous amount of itching in older adults, which is exactly why kidney disease is almost never the first explanation anyone considers. But here's the rule. If you have persistent, unexplained itching that has stubbornly resisted every treatment you've tried, and especially if it's combined with any of the other signs in this video, please ask your doctor specifically to check your kidney function with a blood test. You may have been treating just the symptom for months, while the actual underlying cause went completely unexamined. And now we come to sign number 5, which is genuinely the most counterintuitive sign on this entire list. Imagine this scene with me. You sit down to a meal that you normally really enjoy, a favourite dish, and something feels wrong. The food tastes off, flat, slightly metallic, almost as if there are pennies sitting on your tongue. You assume it must be the recipe, maybe a new spice you used, or perhaps it's a side effect of a medication. Or maybe it's just an off day, you tell yourself. But then it happens again at the next meal, and then the next. Here is the mechanism. As waste products accumulate in your blood due to declining kidney function, those waste products actually alter the chemistry of your saliva itself. And the result is a persistent, metallic, or sometimes ammonia-like taste in your mouth. One that patients often describe, very vividly, as having coins in their mouth. And this taste disturbance changes how every kind of food tastes to you. Meat in particular is very commonly affected. Many kidney disease patients gradually develop a quiet, unexplained aversion to beef or chicken without ever understanding why they suddenly don't enjoy what used to be their favourite foods. And here's the dangerous consequence of all this, the part that compounds the problem. Food starts tasting bad, so you naturally eat less. When you eat less, you start losing muscle mass. As you lose muscle mass, you become weaker and more nutritionally depleted. And your body has fewer reserves to cope with the increasing metabolic demands of progressing kidney disease. The whole cycle accelerates, with you trapped inside it, unable to even understand what's driving it. So here is exactly what to do. If you've noticed this kind of taste change, and it has lasted more than just a few weeks, and there's no obvious cause like a new medication or a dental problem, please mention it to your doctor specifically. Use those exact words. Say, I have been having a persistent metallic taste in my mouth, and then ask for a kidney function blood test. That precise phrasing will trigger the right response. Sign number 6. Your kidneys are responsible for maintaining the very precise electrolyte balance that your muscles need in order to contract and relax properly. Calcium, phosphorus, potassium, sodium, magnesium. All of those have to be kept within tight ranges. When kidney function declines, that delicate balance gets disrupted. Low calcium combined with elevated phosphorus, which is a very common and very early pattern in kidney disease, lowers the threshold at which your muscles fire involuntarily. And the result is exactly what you might predict. Frequent, painful muscle cramps that strike without any warning at all, typically in the calves and the feet. And most often at night, when you're lying still and trying to sleep. The kind of cramp that wakes you up gasping and grabbing at your leg. Now, many people respond to these cramps the way you'd expect. They reach for magnesium supplements. They eat more bananas for the potassium. They stretch carefully before bed. And these strategies do provide some temporary relief sometimes. But here's the thing. If the underlying cause is kidney dysfunction, then those cramps will simply keep returning, and gradually they'll get worse over time. So if you're experiencing frequent night cramps, and especially in combination with any of the other signs in this video, please don't just manage the symptom with bananas and stretching. Investigate the actual cause underneath it. What to do specifically? Ask your doctor to check your calcium level, your phosphorus level, and your potassium level, alongside a kidney function test. These are typically all included in a standard metabolic panel, so it's a simple request. And now we come to sign number 7, the final sign, and in many ways, the most important one of all, especially for anyone watching who is already taking blood pressure medication. This is the sign that connects kidney disease directly to what is statistically the most common health problem in the senior population. And once you understand this single connection, it changes everything about how you manage your blood pressure going forward. So pay close attention. Here is the vicious cycle that millions of seniors are trapped inside right now, today, without even knowing it. Stay with me, because once you see this clearly, you can never unsee it. High blood pressure damages the tiny, delicate blood vessels inside the filtering units of your kidneys. That's step one. Damaged kidneys then respond in two ways. First, they retain sodium and water, which raises your blood pressure even further. Second, they release more of an enzyme called renin, which activates a powerful hormonal cascade that raises blood pressure higher still. So now you have higher blood pressure, which causes more kidney damage, which causes more sodium retention, and more renin release, which raises the blood pressure even more. Around and around, with each problem making the other worse. So here is the warning sign to watch for. If your blood pressure has been gradually creeping upward, slowly but steadily, despite you faithfully taking your medication every single day, that is significant. Or if your doctor has had to add a second blood pressure medication, and then maybe even a third, without ever quite achieving consistent, stable control of your numbers, that is also significant. That kind of treatment resistance may very well be signalling that your kidneys are silently losing function. In the background, this pattern actually has a name. It's called resistant hypertension. And it should always trigger a kidney evaluation. Not just more medication. Not just another pill added to the pile. A kidney evaluation. Because here's the problem. When doctors simply add more and more blood pressure drugs without identifying the declining kidney function underneath, they end up treating the number on the blood pressure cuff, while the underlying damage continues completely unchecked. So here is what to do. If your blood pressure remains above your target range despite taking 2 or even 3 medications, especially when one of those medications is a diuretic, I want you to ask your doctor a very specific question. Look them in the eye and say, "Has my kidney function been checked recently?" That single question, asked clearly and directly, could change your entire treatment plan. So let me bring all 7 of these signs together for you now. Changes in urination, especially nighttime urination, and foamy urine that lingers. A bone-deep fatigue that sleep does not fix. A smooth puffiness around your eyes in the morning. A persistent itching that nothing seems to resolve. A metallic taste in your mouth that's quietly affecting your appetite. Frequent muscle cramps at night. And blood pressure that just keeps rising despite your medication. If you recognized any of these signs in yourself today, here is exactly what to do. And this part is important, so write these down. Ask your doctor for 2 specific tests by name. Just 2 tests. Test number 1 is called serum creatinine. That test is used to calculate something called your eGFR, which stands for Estimated Glomerular Filtration Rate. Now, I know that's a mouthful, but here's all you need to remember. Your eGFR is the gold standard measure of how well your kidneys are filtering your blood. The numbers work like this. An eGFR above 90 is considered normal. Below 60 for 3 months or more indicates chronic kidney disease. Below 30 is serious decline. And below 15 is kidney failure. You absolutely need to know this number. Test number 2 is called a urine albumin test. You may also hear it called a urine ACR, which stands for albumin to creatinine ratio. This is the test that detects protein leakage from your kidneys, the earliest sign of kidney filter damage that we discussed in sign 1. The truly remarkable thing about this test is that it can identify kidney disease years before your eGFR even begins to decline. A single urine sample is all that's needed. Results come back within about 24 hours. And here is what I want you to take away from this. If you are over 60, or if you have high blood pressure, or if you have diabetes, you should be getting both of these tests every single year. Both of them. They are inexpensive. They are covered by most insurance. They take about 5 minutes between them. And yet, millions of seniors across the country have somehow never had them done. But you now know to ask, so please ask. Your kidneys have been silently doing their job every single day of your life, filtering your blood, protecting your heart, maintaining your bones, without ever once asking you for anything in return. The least we can do is check on them. 2 tests, that is all it takes to find out if they need help. And if this video gave you information that could protect someone you love, please share it with them right now, before you move on. Remember, 90% of kidney disease patients do not know they have it. You can change that statistic for one person who matters to you. That's worth a single share. And please subscribe and hit that notification bell. because my next video reveals the 3 common over-the-counter medications that are quietly damaging the kidneys of millions of seniors right now. If you take ibuprofen or naproxen or any common painkiller for joint pain or headaches, you really need to watch that next video before your next dose. And finally, drop a comment below. I'd love to know which of these 7 signs surprised you the most. I read every single comment that comes in. Your story might just be the thing that nudges someone else to get tested in time. Take care of your kidneys. They are taking care of absolutely everything else.